Thank you, Mr. Chairman. First of all, Rob Weehee, thank you for coming to testify. It's been great working with you and Dr. Lofgren and other folks at University of Cincinnati over the past few months to address this unprecedented pandemic. And I was pleased that we were able to get the right testing equipment. Way back in March, you all contacted me and said that you had ordered a test and that you were told by the folks at Roche in this case that they had to take the test somewhere else at a time when we were desperately in need of it in the Southwest Ohio region. So I'm glad we were able to get that test by getting HHS involved. And I'm glad we have increased testing in Ohio. We've now gone from about 8,000 tests a day to about 22,000 tests a day. I think that's the average the last week in the space of about 6 weeks. And that was needed. The problem is people aren't getting the results quickly enough. And I want to talk to you about that. That's certainly the information I have. Some of it's anecdotal, I will acknowledge. But it's basically people say, look, I can now get a test. I went to the pop-up testing center. I'm glad we have those now. And we've used some federal money for that, some of the money that came out of the CARES Act. But I've got to know the results more quickly than 6 to 8 days in order for it to be effective. Someone told me about their kid who had to take a test in order to go back to a sports team, but the results came so late that they had to be retested again. And I don't get that. I mean, we are finally getting the testing up to where we all want it in our states. I'd still like to see even more testing because I think that's essential to getting us back to work safely and back to school and back to using healthcare facilities and in general, leading a more normal life. But I think that not having the ability to get the results quickly enough really undermines those efforts. And again, in some cases, people have had to test and retest, including some of the companies that have asked for testing. And I'm just talking about the diagnostic test here. I'm not even talking about the immunity test, which has other issues we can talk about in terms of its accuracy. But one, Rob, if you could just tell me, do you agree with the information that I'm getting with regard to the timing on tests, how quickly people get results of their tests? Is that accurate from your experience and the data that you have? And then second, if I'm right, I want to then dig a little deeper into why. It's the reagents, it's having the technical expertise, having the technicians available. It's just the machines like the one you have being overwhelmed with the number of tests, I'm told. But I want to get your perspective on both of those things. So Rob, could you give us a little help there?
Yes, first of all, I'd like to say thank you again, Senator Portman, for helping us with the Roche diagnostic equipment. Much needed in the region here. So I do agree there's a lot of variability with the timing of getting test results. And what we're seeing, we have the Roche machine as well as some other machines in-house. We are on allocation on most of our testing supplies. And it presents some difficulties with planning for our lab. The Roche machine, for example, we have folks on all 3 shifts who can run that. It's as I understand it, a little easier machine to run than some of our other equipment. But if we don't know that we can get supplies on that piece of equipment regularly, planning for that is difficult. So that's one element. I think you mentioned the pop-up testing sites. We're a regional site, so we're getting tests sent in from lots of other facilities. But that unknown demand, it can trigger on any day much more than we can handle, or it could be much less than, at a very appropriate amount. So I think from having the correct supplies and the proper personnel inside aligning that with the demand that we may see on any given day does affect the timing of getting these tests back. And I think that lack of coordination, if you will, from end to end contributes to the frustration you're hearing and the public perception about testing capabilities and competence.
Hey, Rob, can you dig a little deeper in terms of the supplies? And again, I'm not trying to make this about your Roche test. I'm asking you more broadly about what you're experiencing in your case in Southwest Ohio. But I think many members have the same question. Is it the reagent that is not available? And I know that depends on the test and where the reagent comes from. I know some come from foreign places, Germany or Asia. in some cases, but what are you talking about specifically that's a bottleneck in the system in terms of supplies, and what could we do to solve that problem?
I think we've experienced a little bit on early on, especially on the swabs that are needed. Many of those came from one region in Europe, and that was hit one of the hardest hit. So
Yep.
that certainly created a barrier early, and continues to be somewhat of a barrier. But then the testing.
Rob, just again, not to, we've got limited time here, but on the swabs, I'm told that we're now making swabs in this country. Specifically, we are using 3D technology and other things to try to produce them more rapidly. Is that accurate? So do you see that problem being solved, or is that still an issue?
So there's been a lot of innovation, and certainly not my area of expertise per se. However, what I can tell you is we've had 3D swabs. We've talked to laboratories, we've brought them in. As we've tested some of those innovative solutions internally, we didn't feel that the results were adequate. We couldn't validate the results in our lab, so we've chosen not to use some of the solutions like that. Some of the other labs, some of the other things that are being produced for other industries as well. So our lab is looking at everything. I think we're doing better than we did early in the crisis. Some of those innovative solutions just haven't proven to be something that we at UC Health have chosen to utilize. Again, to the solution, we are on allocation from pretty much everybody. Some of the testing the production have had issues in production. And it was because of plastics or some other materials they couldn't get, which has severely limited what we could get. As I mentioned early, hotspots, certainly supplies are being diverted appropriately to those areas as well. So I think it's a combination of all those factors, Senator, that's still making it a little bit of an unknown from day to day or week to week.
Okay.
We're going to have.
What I'm hearing from you is supplies continues to be an issue. I give you some homework here if you don't mind. If you could get back to us specifically on maybe talk to some of your colleagues as well. What are the specific supplies? What could be done? The 3D technologies, FDA has gone back and forth with that, and we got to make sure these swabs are safe and that they work well, but we also got to reshore whatever we can. And then if you could help us on this, the fluctuating demand issue, how could that be addressed? Having a bunch of pop-ups is a great idea, but if you don't have the lab capacity to get the test results quickly, maybe the pop-ups, ought to be more consistent and not just periodic. And in terms of personnel, I'm also hearing concerns there. I have more questions for Ms. Denning, and I will get those to her about long-term contracts. We have legislation, Ms. Denning, we're working on to try to get the Department of HHS, but also DLA, Defense Logistics Agency, to use longer-term contracts to provide the incentive for American companies to make the investments to bring back this PPE. And we'd love to hear your views on that, but I'll ask that for the record. Thank you, Mr. Chairman.